And we have Dr. Kireki Omanwa in the building. Karibu tena sana.
Asante sana Mwikali.
It's been a while, but I'm glad you're back here.
Thank you. It's always a pleasure to come here, actually.
Yeah. Karibu.
Yes.
COVID happened, and at the beginning, nobody knew really what it was all about, how to take care of it, how to handle it, or the effects that it would have. Like, probably a long-term kind of effect it would have on people.
That's right.
And one of the areas that really have come out in terms of how people, they have myths around it, they're coming up with their own, theories around it. But today we're here to just break through the myths and understand what really COVID-19, the COVID vaccine, and fertility in general zinahusiana aje.
Yes. Thank you very much for inviting me here.
Karibu.
And I think it is important that we are having this conversation.
Yes.
It's a very important conversation. Maybe a few steps back, because remember the first time people came out, the first cases of COVID-19, that was almost 2 years ago now. It's going to be 2 years now.
Yes.
A lot has happened in between. We have seen how this pandemic has actually opened up the soft underbelly of very, very developed countries. We saw, I think some time back on TV, we saw what happened to Italy, how people are dying in the streets and so on. We saw what happened in the US, even in the UK. Yes. Very, very well developed economies, where the health systems were very, very, more advanced than we have. And the thing that we were afraid of is that if it hit us, then we would be dying like flies in the streets. Yes. And actually that is the information we got from international organizations. Guys, do something, put your houses in order, and so on. We do know that our health system is actually limping. I don't want to say broken, but it's limping. But it's limping.
Yeah.
But thank God that what happened in Europe, what happened in America, has not happened in African countries, because I think we would be decimated by now. But having said that, we still, one death is still a huge loss to anybody, to everybody. We have seen families have lost many members. I have a colleague who lost both his parents in a space of 1 week. And we know that there are people out here who are saying, hii kitu hakuna kitu kama COVID. Hii haijawahi nishika. Hii ni kitu ya Nairobi tu, which is not true.
It is not.
It is something else when you're gasping for that air. This air, you asked, what are we thankful for this morning? We should be thankful that we are actually here, we are talking, na hatuna shida. Hata tukiwa na shida ndogo ndogo, those are actually very small problems compared to when you are in a hospital, you are put on oxygen. This oxygen, God's air, which is free of charge. Lakini ukienda hospitali, wanakugonga. And you actually pay for it.
And sometimes it's not even available.
Sometimes it's not even available.
Yes.
Because we say, as I said, our health system is limping. We have heard of hospitals which are trying to get oxygen. Yeah. Patients being shipped to hospital, and they are told there is no oxygen. My mother was actually in hospital because of that. She contracted COVID, and she was there for a week. And that is when you realize that this oxygen is actually very expensive. Na inabidi tushukuru Mungu. Now, when you come and look at the numbers in terms of infections, we are actually not doing too badly compared again to other more developed countries. We really don't understand why. Some of the theories are that some of the vaccines that we've had in childhood, the vaccine program as we are growing up and so on, could have had a role in that. Is it because that we are in the tropics where we have a lot of sun, a lot of vitamin D, and so on? Or again, is it because that, again, coming back to our limping health system, some of the things that our bodies come in contact with have actually made our immune system stronger than, in the developed countries. We should thank God for these small mercies that we have.
That is true.
So there are a lot of things that we don't know. Now, there are also a lot of things that are coming up. a lot of new information that is coming up. First of all, we didn't know what COVID-19 was. We knew it was a virus, and what kind of virus, the mechanisms. Now researchers have, come up and said we know how actually this virus interacts with our bodies. We know how that infection gets into our bodies. We can see how it affects. We have seen pictures, CT scan pictures, MRIs of how the lungs are scarred by the virus, and so on and so forth. Now, in the face of all this, how do we mitigate the effects of COVID-19? Obviously, there have been a lot of medications. If you go to the internet now, there have been quite a number of studies. Say, unajua ukitumia ivermectin, ukitumia hydroxychloroquine, if you use, azithromycin, you use zinc, vitamin D, vitamin C, and so on and so forth.
Yes.
All that is okay. We also now, in the scientific world, we actually use evidence. How many of these people have used these medications?
Yeah.
What ages were they in? What stages of infection did they have? How many of them survived? And then we can say, okay, if X number took this type of medication and this one and X number did not take, and the ones who took the medication actually survived, and the difference is what we call statistically significant, then we can actually say, if you took a combination of these medications, this will help. A lot of controversies that have come up, a lot of fraud as well, because some people want to push this and others want to push that, and so on. Now, we know that treating viruses is not an easy thing. The common cold is a viral disease. It has been with us for ages.
Yes.
And we don't have a medicine for the common cold. Even in Europe, where the flu, which is part of the common cold, is quite common, they have a vaccine which keep on changing every so often because the virus itself keeps on mutating. So now we are in a position whereby we have something novel. We don't know exactly how to deal with it. Let's go back to the stores there, the research that has been done. Is there something that we think that can help? And now we have vaccines. We have the AstraZeneca vaccine, we have the Moderna vaccine, we have the Johnson & Johnson, we have the Pfizer vaccine, and so on. All of them have their positives and negatives. But by and large, from the information that we have and from World Health Organization, is that taking these vaccines actually do help. How do they help? They either stop you getting infected, or if you do get infected, then the effects of that infection are actually not too bad. You may not end up in the ICU, for example, and so on. Obviously, just like in medicine and in life, there are people who will say, ini ukora, oh, wanatupatia hii, they don't want us to give children.
In about 20, we
exactly.
Won't have children.
They are cutting our fertilization,
Yes.
and so on and so forth. You don't think about sex, you don't think about fertilization when you're gasping for air. You don't. You don't. So we have to put this very, very clearly, that actually sex and fertilization and all these other things are secondary to your breathing. And this virus affects your breathing. When you are in ICU and HDU, you are not thinking about sex, you are thinking about surviving.
Yes.
So get this vaccine. Itatusaidia na inatusaidia. And I want to take this opportunity as the president of the Kenyan Obstetrical and Gynecological Society to applaud the Kenyan government. They are actually trying. We have tried. Wamepata AstraZeneca, wamepata Moderna, wamepata J&J. So we are actually really trying. So what my position is, let as many people as possible get vaccinated. Okay. This will help us start opening up the economy properly. And we know that the economy has taken a battering.
That is true. Very,
very seriously. Look at the tourism industry; it's practically, collapsed, and other industries as well. Yesterday, I was talking to a friend of mine. Anauza nyanya, vitungu, and so on. So he told me, things are bad because before COVID, I was selling these to people. Now, because the economy has taken a plunge, those people I was selling to are actually also buying vitungu na nyanya na wanakuja wanauzia wengine. So it has become a problem. So having this vaccine, and obviously the vaccine is not everything. we also need to think about wearing that mask properly,
Yes.
using the sanitizers, the social distancing, and so on and so forth. All these come together so that we can help each other. Now, coming back to the issue of how has this affected our women? There's a huge,
So are we confirming that it has?
yeah, I'm confirming that it has.
Okay.
It has affected.
Okay.
And it has affected our women, especially our pregnant women, expectant mothers, in a huge way. In reproductive medicine, we have what we call 3 delays. The first delay is in making the decision. This is a pregnant mother, and I have to go to hospital. But now, in the face of COVID, these 3 delays have actually taken on a completely different dimension. So the first delay is at home. Now, if I'm going to make this decision to go to hospital, my date of delivery is a certain date. That date has come and it has passed. My husband, who used to work, does not have a job. The little money, the little job that I used to have, maybe I have a kibanda somewhere, and it's basically collapsed because there are no customers coming. So how do I make this decision? Do I take this money, the little that I have, do I use it for transport? Do I use it, or do I buy food for my children? Because in the home, basically, pesa haziko. So the first delay is at home, that making that decision at home. The second delay is in transport. I'm living somewhere, the hospitals are far away. God forbid that the labor pains start in the night. How am I going to go from home to hospital? The transport. Will I get a car? Will I get, matatus? Matatus are not operating in the night. If I take a cab, do I have money to pay for it? If I do get money to pay for it, there are roadblocks on the way.
Are they even available?
Are they even available? The transport is even available. And even if it is available, kwa roadblock, polisi atasema hebu tuonyeshe barua. And labor pains don't say sasa barua imekuja sasa twende hospitalini. And they don't respect that. Asema rudi nyumbani, that sort of thing. So there is that anxiety. Will I make it through that roadblock? Now, if we have come through these two delays, the third delay is in the health center or in the hospital. Number one, we know this is a disease which has brought about stigma. We don't know how it has been, in the beginning. Now we do understand quite a bit of it. Now in the hospital, you remember, in the beginning, there used to be also social distance. It is still there. Yes. There are so many women coming at the same time. How do we social distance them? How do we triage them? How do we separate them? And then those ones who have symptoms of this disease, where do we keep them? Do we have enough wards? Now, that may not be so much of an issue, but do we have enough personnel who are equipped and who have been trained? Now, the personnel may be there, but do we have enough equipment? Remember in the beginning, we had a lot of issues with PPEs, personal protective equipment, which was not available, or when it was there, it was scanty and so on. So nobody wants to go to help other people, and then that same person gets infected and then has to go back home and infect his or her family. Actually, the first principle is make sure you are safe, yourself first, before you can help others. So these are some of the issues which we have been grappling with. Now, the knock-on effect of this is that patients get, in the beginning, they were fearing to come to hospital.
Yes.
I'll go to hospital.
I'll be isolated
healthy
from my family.
I'll be isolated. There's the psychological, aspect of it. I may also contract COVID-19 in the hospital. Wacha mimi nizalie nyumbani. And then it complicates at home. Start bleeding, for example, or you have, a protracted labor, and then there are other issues which come about
because you're not well versed in this. You do not know the beginnings of giving birth. It's not like our grandmothers. Somehow they figured it out.
They figured it out, but also they also lost a lot of children, a lot of babies as well.
We are going to take a very short commercial break, but if you have any questions, we're talking COVID-19, COVID vaccine, and fertility. 111 444 111. That is our SMS line. We'll be right back with Daktari after this. Welcome back to Full Circle with Mwikali. Remember, we're taking in all your questions when it comes to COVID-19, the COVID vaccine, and fertility in general, because it's been a growing concern, not just locally, but across the globe. And that is why Dr. is here to just help us understand what really happens. And we were talking about the 3 delays,
Yes.
and we covered through them. And that happens, when that happens, then there's a high chance of loss of life when it comes to the child. Maybe the child will come out with complications.
Absolutely.
Or loss of death when it comes to the mother as well.
Absolutely, absolutely. Now, that has a knock-on effect because when you look at what we call our maternal mortality rate, which had actually started dropping nicely, it was around 338 in 100,000 women, which is still quite high.
Quite high.
Considering some other countries have 4, maybe 10, and so on. But we had made a bit of progress. But now with this COVID-19, with all these other issues surrounding it, the fear, the stigma, and so on and so forth, that number has also gone up a bit. We are waiting for the statistics which the Ministry of Health collects and puts it together and then avails it to us. Okay. But what we can see, or what we have been seeing in the hospitals, is that sometimes these patients come and they are late. Now, something else which I would like to point out is that there has been quite a lot of lack of information. The Bible says, "My people perish for lack of knowledge." We have this knowledge from other countries, and it's not what we call in research. It's not what we call prospective studies, whereby we are going to subject pregnant women to a study. And we say, okay, let us see. Mwikali is expectant and other women are expectant. Wako na COVID-19. Let us wait and see what is going to happen. But these are patients who have come to hospital. They are expectant, and unfortunately, they have COVID-19, and they have been followed up. And they have looked at the results, the end effect, how the babies were born, and so on and so forth. And then we take a step back and say, look, why don't we vaccinate them? Because if we vaccinate them, then we have what we call secondary immunity, which the children will have, the babies will have in utero, and especially when the mothers are actually lactating, because the body will produce antibodies, and those antibodies are circulating in the system, and some of them will actually go through the baby's, the mother's milk into the baby, which offers actually the newborn's protection. I want to take a step back because before we gave out this statement about vaccinating pregnant women and lactating mothers, quite a number of expectant women had been turned away from health centers, from hospitals.
Yes.
We don't know what is happening, so, and you are expectant, we don't know about this vaccine, enda nyumbani and wait for the directive. 2 of my colleagues gave very sad examples. Actually, 2 patients were turned away from hospital. One of them was carrying twins around 33, 34 weeks, and another one was carrying, a singleton pregnancy, turned away by healthcare workers because they didn't know. Went home and got admitted later on in hospital because difficulty in breathing. And with the changes in pregnancy, you find as the uterus increases in size, it pushes up what we call the diaphragm. So the lung actually does not expand as much as it is supposed to. So on top of that, you have issues of not breathing properly. So these ladies were in dire straits, as it were. So the question is, we have a WhatsApp, group where we say, I have a patient like this. What do you think we should do? Because sharing knowledge is important.
Yes.
I said, I have such a patient, and this is the situation we have, carrying twins and so on. Said, okay, do this. Maybe you can do this, and the advice you are given. And then after a few days, one of my colleagues said, you know what, that my patient, unfortunately, she seriously desaturated, meaning that her oxygen levels dropped seriously, and they had to make a quick decision of removing the babies. So they removed the babies, but unfortunately, after 2 days, she passed away and left 2 children. The other one who had had a singleton, one baby, carrying one baby, also unfortunately passed away and left a baby. So, and these are the tip of the iceberg. So that is why we came back and said, look, let's look at what is happening in other parts of the world, what are they doing with their pregnant women? Are they vaccinating them? Is there discrimination? And if they are not allowing them to be vaccinated, what is the reason for that? So when we looked at the information from other bodies, other societies, and we looked at literature, we actually saw that there is evidence which is for vaccinating women who are expectant and women who are lactating, because not vaccinating them actually led to a lot of issues and even death. So that is why the Kenyan Obstetrical and Gynecological Society came up and say, look, all expectant mothers, please get vaccinated. And because the benefits of the vaccine are much higher than not getting vaccinated. So it's actually it's a rallying call that
So
those ones who are doubting. Yes.
And there's a lot of fear and stigma around that.
Exactly.
So because we do not know, then we quickly choose what is comfortable for us.
Yes.
Which is not getting the vaccine.
And which may not help us.
It
doesn't help us.
Yes.
It does not help our babies. And actually the secondary effects is that it affects our families as well. Because if you have a baby, 2 babies, and you have a husband, and then you are pregnant, and unfortunately you get COVID, you probably never got vaccinated, and it affects you. The other effects of not getting vaccinated, and these women who have had infection with COVID, you find that, number one, they deliver very early. Premature delivery. Now, premature delivery has its own consequences as well on the newborn. Some of them are born, very early, 25, 28, 29, 30 weeks. The biggest problem is their lungs. If they are not prepared, they have not been given medications to prepare the lungs. So they come out, the lungs are not ready, they cannot be able to breathe properly. Their eyes can be affected, their brain can be affected, etc. So you have a plethora of consequences which later on you have to grapple with the whole of your life. And one of the worst things is to take care of a handicapped baby. So these are some of the things which the public needs to know, that it is important, it is good, it is preventing some of these consequences by getting vaccinated. And even when you're lactating, please let them go and have this vaccine. My patients come and they also text me and say, Daktari, do you think this vaccine is safe? I say, please get vaccinated yesterday. Don't wait. Yes.
We have a couple of questions here for you, Daktari. One is probably because we've talked about the women a bit too much. So does COVID-19 and the vaccine affect fertility just on the women and their pregnancy process, or does it affect the man as well?
Well, so far we don't have any evidence, because as I said, we look at what is happening up there and we interrogate this evidence. We have not seen any evidence. The other day I saw a clip, one of the MPs saying, watu wanasema ukidungwa hii chanjo transformer itakataa kufanya kazi. Mimi nataka niambie watu, as the MP, nataka niambie watu nimedungwa na hii transformer inafanya kazi vizuri kabisa. So it was a humorous way, but a good way of actually passing out that information. We don't have any evidence so far that actually getting vaccinated will affect, your bedroom issues in terms of men, that is.
Okay, great. So generally what causes infertility, so that we just get that out of the way?
That is my pet subject.
Yes, I know. I know.
My pet subject. But anyway, to break it up just very, very generally, there's infertility for men and there's female infertility. Today, let me talk a little bit about men, because most of the we have a tendency.
Like, okay.
Now, for male infertility, we have different reasons. We may not exhaust them today, and I'm not putting them in any order. Just the way the reasons, many of them. Undescended testicles may have testicles, because normally when a boy child is born, is in the mother's womb, actually the testicles have been formed. They actually fall, not really fall, but they go slowly and they go into the scrotum. But sometimes they don't, either one of them or both of them. You may have issues with what we call congenital absence of the vas deferens. The vas deferens is actually the tubes which actually where through the sperms pass through. Luckily, this is something which is very rare, and it's a hereditary disease, a hereditary, sort of cause, and we don't see much of it in this part of the world. You may have, the biggest issue is blockage of tubes, and this leads to what is called azoospermia, lack of sperm, because normally what happens during intercourse, sperm are stored elsewhere, they're produced elsewhere, they're stored elsewhere, and during that intercourse, in microseconds, they move from where they are stored, they pass through the prostate gland and come out with the seminal fluid now as an ejaculate. If there is a problem with these tubes, if they are blocked for any reason, one of the biggest reasons is because of infection. And infection, sexually transmitted diseases, if you're playing away matches and home matches and so on, you don't know what you get, you end up having this infection, the tubes are blocked, so what comes out is just the seminal fluid, but there is no sperm. There can be an issue of production as well, in that if the hormone levels are elevated, and here we are talking about 3 or 4 hormones. One of them is called FSH, follicle stimulating hormone, and the other one is called LH. Testosterone is also very important. Prolactin also does play a role, and also one that is called thyroid stimulating hormone. So all these hormones should work together, or must work together, for a man to be able to produce sperm and have and procreate as it were. Trauma, for example, injuries, whether it's in football, karate, whatever it is, that can be an issue. Medications, there are all manner of medications. For example, some of the medications that we take for high blood pressure. Some of the medications for treating cancer, the medications for treating diabetes. For diabetes one, they actually may lead to a serious drop in libido. And if you can't have an erection, then obviously there are going to be complications, in procreating naturally. Radiation, radiotherapy. And then now there are other issues. Now when you talk about trauma, there is trauma to the brain. For example, you may have brain tumors which will affect the centers of creating an erection. If you have injuries to the spine, for example, and so on and so forth. And then there are other issues now where lifestyle issues. What we eat, what we drink, the more we put on weight, unfortunately, the less active we are in the bedroom issues. The other thing is the more we want to be more muscular, we go to the gym. Some of the things that we take in order to build muscle, and some of them actually do have testosterone, and the effect is actually the other way.
Reverse.
In that we have what is called an reverse. Basically, the brain tells the testicles that produce a bit of testosterone, and then when it is enough, it also we have what you call a negative feedback mechanism. So when there is a lot more testosterone in the system, the brain stops
because there's a lot.
There's a lot more. You don't need a lot more.
You don't need to produce more.
So what happens when there's a lot more in the system? Kule chini, the testicles start becoming smaller. So the muscles, we are building the muscle, lakini kule chini is becoming smaller. So in the end, you may not be actually very active. You look very good, but uko chini,
nothing's happening.
Hakuna kitu.
Okay.
So
that's the guys. We'll probably focus on the women next time. Today is just, tuko na maswali zingine daktari.
Sawa.
My husband suffered erectile dysfunction a few days after getting the jab. I don't know if it was the symptoms or what, or the shock, because we had also lost a lot of relatives to COVID. Can this affect someone? So there's a bit of trauma here.
Yes.
There's a bit of shock as well. And then there's the fearing that it could be the jab.
I think the jab is a surrogate for that, because remember, for men, stress, any kind of stress, will affect the bedroom matters very, very seriously.
Yes.
And here she says that her husband lost quite a number of relatives, and the trauma and so on, and then you go and get that jab. So I don't think they're connected.
Okay. But
my feeling is that it could be the trauma and the shock and the stress from the deaths from the relatives.
Okay. Hi Mikali, I'm a lactating mom. It took me a while to be vaccinated because I was told I'm not eligible. Fortunately, I got the Moderna shot on Friday, but my worry is they did send me the SMS. Also, how many shots do I get for Moderna? I am Maggie from Dagoretti.
Maggie from Dagoretti. Most of these vaccines are actually two vaccines, the AstraZeneca and the Moderna and so on. The one that we know that you get one is the Johnson & Johnson. So I'm sure since she got the first jab, they will send her information on when to come for the second jab. Usually at the beginning, the interval was about 6 to 8 weeks, but this has been extended slightly to about 12 weeks. So I'm sure they will get her. So it's in about 3 months' time, she should get another one. Anywhere between 8 to 12 weeks, she should get another jab.
Okay. Hi, Mwikali. I am Eugene from Umoja. I was asking if the vaccine can alter my child's skin color.
That would be, no, we don't know anything about that. Absolutely. We don't know.
And I'm wondering, is the child's skin color while still
In
the womb,
the womb
or when you're lactating?
I really don't think so.
Okay.
Really don't think so.
Morning, Mwikali. Is it safe for me to get a jab if I'm interested in getting pregnant?
Actually, that is another aspect as well, which patients have been asking. I'm planning to, in 2 months' time, I'm planning to have a baby, or I'm planning to go through the IVF process. Do you think the jab is going to affect this process? The information that we have is that it will not affect this process. So please have that jab and continue with your plans of conception.
Okay. So whatever process you're using to get your baby, because if you're going through the IVF, there's so many other things that you should consider.
Exactly.
So the vaccine should not. Is there a time period where if I got the vaccine today, then I need to give myself some time before I start the other process?
What we are saying is that give yourself a week, 2 weeks, and then you can continue. Why is it a week, 2 weeks? Because there can be side effects. There can be itchiness. You may have muscular aches. You may have, and so on and so forth.
The general reaction.
The general reaction. So give yourself that time so that your body settles. Once your body has settled, then you can just continue with your plans. There should be no interference at all.
Okay.
Yeah.
So to come to the end of this conversation, Dr. Harry, what we are saying is COVID-19 has effects in one way. The one that we've established, the delays in not being able, especially to the women, not being able to make the decision of giving birth or going to the hospital, or the delays as you're scared, the stigma, the fear. That is the reaction to probably what affects the women, especially the pregnant ones.
Yes.
But generally, the thing would be to get the jabs that you even feel safer to go to hospital.
Absolutely.
That it does not affect the men as well. So we all go out there. If you're lactating, that it's okay for you to take the jab.
Absolutely.
Okay.
That is what we are saying. Please, ladies, go out there and get vaccinated. It will protect you, protect your babies, and protect your family and community as well.
Great. How can we get in touch with you? Where do we find you, Dr. If we're going to take this jab and start this journey of getting pregnant?
We want to welcome you. I'm located at 5th Avenue offices, which is along Gong Road on the 3rd floor, suite 314. So 5th Avenue offices, 3rd floor, suite 314.
Asante sana, Dr.
Karibu sana.
Always a pleasure having you on the show.
Asante sana.
We're going to take a very short commercial break. We will be right back. This is Full Circle with Mwikali.